So I'm Dr. Praveen S. I'm a consultant interventional cardiologist working at KIMS Health, Toronto. So Maldives, we know, has a long history of relation with India. Essentially, we consider Maldivians as like Indians only when it comes to being treated as patients. So Maldives has a lot of similarities with India. The same, I would say, holds good in the case of heart disease also, because just like Indians, Asians, Maldivians are also prone for heart disease. Just like our Indian people with heart problems, the same type of heart problems we encounter in our Maldivian friends also. And as an institution of high repute in Maldives and as a quaternary care center in India, KIMS Health has a long tradition of treating Maldivian patients with heart disease, and that relation continues even today. I would say that they would be most happy to have got the best of treatments when it comes to cardiology from KIMS Health. Now, when it comes to the facilities we offer at KIMS Health, Toronto, for cardiology, I would say that we have one of the top cardiology centers or institutional top cardiac facilities in the whole of the country, India. We have a fully functional cardiology department with 8 consultant cardiologists of good skills, repute, and qualification who are well versed in the treatment of all varieties of heart disease. We have a fully functional, non-invasive cardiology, that is, which basically deals with the diagnosis and treatment. When it comes to non-invasive cardiology, you have a full-fledged echocardiography with 5 state-of-the-art echocardiography machines, in which you can do even the highest of or the recent advanced forms of echocardiography. Then we have usual cardiology investigations like the treadmill, the ambulatory BP monitoring. You have a prolonged ECG monitoring called a Holter, which even goes to monitoring a patient beyond 5 to 7 days. Of course, we have a full-fledged cardiology ICU backed by a full team of resident doctors and other departments to help us. And when it comes to invasive cardiology, which is the highlight of today's cardiology practice, we have fully equipped cardiology cath labs, 2 cardiology cath labs, with all the facilities for angioplasty, emergency treatment of coronary artery disease, as well as treatment of structural heart disease, as well as treatment for other heart disorders like heart rhythm disorders, where you need to put in a pacemaker or any other further higher end devices. When it comes to angioplasty and cardiology interventions, we have all the facilities for intravascular imaging like intravascular ultrasound, other newer modalities like FFR, rotablation, and we also have pioneered the use of valves for structural heart disease by minimally invasive procedure like TAVR in South Carolina. We also have expertise in the treatment of other structural heart disease like non-surgical treatment of structural or congenital heart diseases which happen by birth like septal defects and all those things. So I would say that someone comes from Maldives for treatment at KIMS Health, we can assure you that when it comes to cardiology, we will be able to provide, and we have been providing, the best of care which they can get anywhere in the world. So as I said earlier, our cardiology team is fully equipped, and we have the full support of our cardiac surgery team, which also helps us in helping the patients have a good result. And they have been very proactive in initiating ECMO therapy, which is called an extracorporeal membrane oxygenation therapy, which often saves critically ill patients. And that proved its worth during the times of COVID and otherwise, when you have critically ill patients where their heart and lungs need to be supported. And ECMO has saved quite a number of them. So the Maldivian patients, majority of them, there are 2 sets of patients I would rather say. One comes on their own, and second set, of course, we have a very good referral system through the Asanda system, the health insurance scheme from Maldives, which I would say they have been very helpful in granting the required support for the patients for treatment of various heart ailments. I would say that Maldivian patients are patients who really have a good rapport with doctors. I still remember the case of a patient who came here without much hope because he was told to have a severe heart disease, which couldn't be anything, nothing could be done for him from outside. So after that, of course, we treated him. He went well. Now, after that, he actually mailed me from Maldives, and now after that, he annually visits me every time with his family. He never forgets to take a selfie with me every time he goes back. So that rapport, I think, it has been continuing on without default for the past 4 or 5 years, except for the last 1 year because of COVID. Maldivians, as I would say, is Asians, right? So we Asians, or rather we South Asians, which definitely includes Maldivians, are genetically more prone for heart disease compared with Japanese or others. So just like Indians, they are also prone for heart disease. First point. Second point, the incidence of smoking. That is high, I would say, the patients may encounter. So probably the incidence of smoking is high in Maldives also. That would explain. Of course, then diabetes is also coming up in a big way in a lot of patients, which also adds to the burden of heart disease. I would say these are the important causes. And the point here is the causes are not much different from Indians because basically we're all South Asians.
That's all then. Yeah. Thank you so much for your time.
Welcome.
Yeah.
You're welcome.